When people think about Parkinson's disease, the first thing they think of is tremor or involuntary shaking of a limb or their head, or maybe something as simple as a toe on one of their feet. People may notice unusual stiffness or rigidity in their body, not the kind of typical morning stiffness that you shake off after a couple of minutes after getting out of bed, a real rigidity and stiffness in the limbs that restricts movement. Their gait or how they take steps has changed. We see people take smaller steps and shorter steps, and some people with Parkinson's have difficulty lifting their feet off the floor when they walk, so that their walk resembles more of a shuffle than a nice even stride. People with Parkinson's may also notice that their facial expressions are reduced or restricted. Sometimes people with Parkinson's will have more of a flat, very serious appearance. They may not blink as frequently. They may also notice changes in their voice. Their voice may become lower or huskier or sound hoarser. Changes in gastrointestinal functioning. They may experience unusual constipation or diarrhea. They may notice changes in their ability to taste and smell. Odors in the air and food doesn't taste or smell as vibrant as it used to. As Parkinson's progresses, the tremors can become more frequent, more difficult to control with medication. The gait changes may worsen, and rigidity may also worsen. As Parkinson's develops, people can also have non-movement symptoms, changes in their thinking, such as difficulty concentrating, difficulty remembering. They may have changes in their visual processing. They may visually misidentify objects. They may mistake one object for another. They may even see things that aren't there. One of the biggest cognitive changes in Parkinson's disease is slowed processing speed. So just as Parkinson's disease is associated with slower movement and difficulty initiating or starting movements, Parkinson's is also associated with slower thinking and difficulty initiating behavior. If an individual suspects that they have Parkinson's disease or has symptoms that they are concerned about that sound like Parkinson's or feel like Parkinson's, the first thing that they should do is contact their primary care physician, who can listen to their symptoms, hear their concerns, do a physical examination, and if necessary, refer the person to a neurologist for further workup.